This week, in his first network television interview since becoming Health and Human Services Secretary, Robert F. Kennedy sat down with CBS's Dr. Jon LaPook. Kennedy said he was not familiar with cuts to programs that could have a devastating impact on infectious diseases and mental health. Well, tonight, Dr. LaPook reports how some of those controversial cuts could impact you.
Every human has health needs. The need for public health doesn't disappear just because there isn't funding for it.
Dr. Megan Ranney is dean of Yale University's School of Public Health, a global leader in medical research. The federal cuts have eliminated at least a dozen scientific grants at the school, covering mental health, genetics, and infectious disease.
The announcement of almost $12 billion of cuts to state and local health departments, that's directly affecting our ability to track bird flu, measles outbreaks.
Dr. Ranney spent decades as an emergency room physician. She says while funding priorities change with every new administration, these latest cuts have left her puzzled.
Has anybody given you any rationale that makes sense to you for cutting these specific grants?
You know, we get letters saying that the grants no longer go along with the priorities of the federal government.
So nothing more specific than that?
Mm-mm.
Now, scientists aren't sure what the NIH may consider problematic. For example, cancer and infectious disease research involving messenger RNA, technology that became politicized when used to make COVID vaccines.
There seems to be some magical list of forbidden words, and people are trying to guess what those are because they don't want their grant to get flagged.
What's the long-term repercussion of not doing basic science now?
We're not going to feel those effects for a while, but they're going to be real. And we're going to watch that innovation and ingenuity go elsewhere.
Brain drain.
Yeah.
CBS News has counted more than 36 Health and Human Services offices and programs that are either being downsized or eliminated. They include mental health, environmental health and asthma, and injury prevention.
I would be the first to say that we need to improve efficiency at government. However, this is not that.
Connecticut Public Health Commissioner Dr. Manisha Jutani says the cuts are more than an academic problem and will compromise services such as vaccine education and in-home support for parents of newborns.
How soon will losing these funds actually affect the life of a person?
I'd say today. To do this in a way where you don't think about the investments you've already made, millions of dollars of investments that are now going to be lost, is short-sighted. Let us finish this work.
But for now, whether the work will go forward is very much in question. Dr. Jon LaPook, CBS News, New York.